Our first presenter this morning is Bhaskar Anepu with a company called Smirta. Uh, Bhaskar and he's going to explain. He's going to share this company with you more. But I find it fascinating that it's in the healthcare industry, um, of how technology can really improve, what we are doing in the healthcare industry. The concept is really fascinating, and I'm certainly looking forward to, for him to share his experience with us. And then Deb is our regular 1 Million Cup attendee. He has also presented in the past. And Deb will be presenting about Valley Fruits and Veggies, which is located in Lehigh Valley. So another great presentation from her later today.
Good morning, everyone. I'm Bhaskar Anepu, co-founder of Smirta. It's a digital health company, and I'm going to present one of our products, CareBot, today. A couple of years ago, our 2-year-old daughter accidentally ate a walnut and started to develop rash. She has tree nut allergies. My wife and I, both of us were home, and we realized it's not really serious, so we took her to the closest urgent care center. To cut a long story short, after 45 minutes at the urgent care, we were shipped to an ER. And after a total of 6 hours on the road and 1 dose of Benadryl, we were back home and our daughter was fine. This didn't make a lot of sense. My wife is an ER physician, so she knew this is not so serious where we had to go to an ER. And I'm a tech guy, so I definitely looked around to see what the best option is, and we went to the urgent care. But it happened to be the wrong urgent care. If only we drove 5 minutes in a different direction or farther, then we would have gone to a pediatric urgent care where they would have taken perfect care of my daughter. In 30 minutes or under an hour, we would have been home. Also, the insurance company wouldn't have to pick up a $1,500 tab for the ER and the urgent care visits. So it really was perplexing because there is so much technology around you and all of this information, but there was no solution that could actually put all of this together in such a way that the end user can make an intelligent decision in a reasonable amount of time. So I said, there's definitely something we can do here. I quit my job. I was working at Intel at that time, and I started Smirta, and CareBot was our first product. Now, for people who are thinking, this is a corner case, it doesn't really happen that often, I know where to go when something happens. Well, let's look at some numbers. In 2017, there were almost 140 million ER visits in the country. Now, 40% of them are deemed unnecessary, which means either they can be taken care of in an outpatient setting or just by taking better care and staying at home as well. Now, to put a dollar value to this, let's say we consider only commercially insured patients, which is 30% of the total population. So 30% of 55 million is about close to 17 million people who could have avoided ER visits. And $1,000 differential between an ER and an urgent care, which is still conservative, we are still talking about over $16 billion in unnecessary spending just for this one use case. I'm not even considering telemedicine, which is even cheaper, or PCP appointments. So this is a real problem, and it is a very serious problem. Further proof. Blue Cross Blue Shield of Georgia in 2016 said they will stop reimbursing for unnecessary ER visits. Now, how would a patient know if it is necessary or unnecessary unless they're given the right tools to decide? And nothing like that really existed. And now they do that in 6 different states, and other insurance companies are following suit. Employers and health systems are really struggling to see how they can bring down the high cost claims for the same reason. So CareBot is the solution that we came up with. It's a complete end-to-end platform that starts with triaging a patient using artificial intelligence based on their symptoms and other relevant information. Once the right care facilities are identified, those are prioritized, ranked and prioritized based on several factors, so that all the guesswork is taken out of the user's hands, and instead they are provided with a prioritized list. Once the patient selects where they want to go to, the solution is going to connect them with the provider. So they can schedule their appointment, send their insurance information or anything else ahead of time. And then once the care is done, there's a post-care follow-up where the patients can review the facilities, or the staff can follow up with the patient to make sure that everything is going right. There are three key moving parts to our platform. The CareBot engine is pretty much the brains. It deals with the triaging, the ranking, the connectivity aspects, and other technological pieces. The kiosk is typical to many other kiosks that you see that a patient can use to check in at the facility. We deploy this at our customer sites. A dashboard is a web interface, or it can also be integrated with an existing EMR of the provider site, so that the provider staff can oversee, monitor, and manage their patient flow more efficiently. Now, how does this fit into existing workflows and people can use it? It integrates seamlessly into any existing patient-facing portal. So today, if you really go to your insurance website or a hospital website, they expect you to do all your research with WebMD, Google, and just go pick a specific specialty or a location so that you can schedule an appointment. But they do not help you figure out where you need to go to begin with. So a patient portal with CareBot integrated into it will start with understanding what your problem is, diagnose, then divert you to the appropriate care where you can get it. If we dig a little, or actually if we take our example now into perspective, then the triaging part would have helped us identify that we can go to an urgent care. Maybe in our case, it was not necessary because my wife did the real triaging, but that's not always the case. And once urgent cares were identified, it would have prioritized the pediatric urgent care over the others based on the patient information and the current symptoms. So we would have picked that. Now, Google didn't help because there is no pediatric in the name of the urgent care center, so it just showed it as an urgent care, but it was lower in the list because it's not the closest one. So here, there's a lot more clinical and relevant information that is taken into consideration. Then we would have just sent our information to the facility, and they would have been better prepared because they knew who is coming in. And anytime it is a pediatric case, usually they try to put a doctor on instead of a physician assistant or someone. So all of this would have been handled in a much better way. Then we could have come home in less than an hour and maybe just with like $100 copay. Sorry, $100 at the urgent care instead of $1,500. If we dig a little deeper into the key aspects of this, the AI triaging part uses machine learning algorithms, and we have developed this with the help of expert ER physicians who are on our clinical board. It takes into consideration a patient's symptoms, demographics, and other relevant information in order to diagnose what the problem is. Once it is identified and the appropriate care facilities are chosen, they are run through a couple of patent pending algorithms that take into consideration several factors from several different sources. When you have, say, 10 different urgent cares within a 15-minute driving time, which one would you go to? What is the best possible, best facility to go to at this point of time? There is no solution, or there is no platform that tells you that today. So this takes into consideration all the information that is relevant and then gives you the prioritized list of facilities. For the health systems and insurance companies, everybody, there are a lot more features here too. The platform is capable of computing real-time wait times so that they can advertise them. If the facility already has wait times that they're advertising, this can simply tap into that and provide that information to the end user. You can let patients schedule themselves or reserve a slot. And advertising peak and off-peak times significantly helps in load balancing patient flow, across different facilities for a given health system, or even within a facility in a given day. Then communication with the patients so that they can keep them posted if an unforeseen emergency comes up and then there's going to be a delay in care. This can improve the quality of care significantly. And then the data analytics part is quite powerful for predictive modeling and intelligent staffing. There are a whole bunch of other bells and whistles. Some of them are already integrated into our platform. Some of them are being worked on as we speak, and the others on the roadmap. Especially with this COVID thing, we know that telemedicine has become a significant player, and there's actually $60 billion that is going specifically only to telemedicine support in rural areas. So we can see that this is going to be a trend going forward as well. And more people of all demographics are adapting to technology, who are not so comfortable using this in the past because of the current circumstances. And we foresee that solutions like these are going to become more prominent and also will significantly assist in people making better choices. Again, thank you for your time, and I'm open for Q&A.
Bhaskar, thank you. Thank you for your presentation, and there are some questions coming on the chat, so I will read that to you as we move along here. So where exactly are you with with Smirta right now? So it's already operational?
Yes, we have an urgent care center in Long Island, New York. We are with a small employer in Jersey. We were very close to deploying to a really large 300 facility health system in Canada just before COVID hit, and that thing went on hold.
Okay, great. So here's a question from Sam. The question regards, it pertains to your CareBot platform. So does the CareBot platform select providers based upon in-network providers for the insurance a user has?
That's just one of the options of several available. So if the user restricts the options to only in-network, then that is how they can filter. So it's totally in the hands of the user, yes, what kind of results they want to see.
Yeah. The question from Mike here, is this a subscription service for the care providers? If so, how does CareBot recognize the major hospital networks, walk-in care clinics that compete with others, such as, let's say, Patients First?
So, yeah, very good question. So it is subscription-based, correct? For health systems, we identify the locations only that belong to that health system so that they can keep the patients in network within their network. For insurance companies and employers, it's going to show all the facilities. So, and with respect to the database, we have several sources, one of which is our own proprietary database that we use to make sure we identify urgent cares appropriately. We differentiate them from walk-in primary cares that act as urgent cares, but usually insurance companies don't reimburse for that because they say it's not an urgent care. So we have our own proprietary database that's cleaned up and has much more valid and useful information in there, in addition to several other sources that we use.
And Bhaskar, I don't know if you touched that in your presentation or not, because I was paying attention to the chat. What's your revenue model? So how do you make money in this process?
So it's SaaS platform. So insurance companies, employers, and health systems, they pay on a subscription basis. It can be a monthly, it depends on the size as well. So it can be a monthly subscription or use based, so that depends on how many queries are sent to our engine, because this is all based on cloud. And every time the interface goes through the patient portal, it queries our engine for triaging, whether it be triaging or the results. So there's a combination of these. And if we are talking about the kiosk and the provider dashboard, then we are going to charge for that as well for the health systems when we deploy those.
So right now, the subscriptions are sold to organizations, companies?
Yes, health systems and insurance companies are our major customers, correct.
Yeah. I think John has a good question here. What are the liability considerations for giving advice, and how do you minimize that risk?
That's a $1 million question that we always get. So liability in healthcare, especially, there is no way there is rate zero liability. So we ran this through a bunch of lawyers, and we have well, other than, if you honestly look at it, there are several solutions out there that sort of do diagnosing and tell you what the best possible options are. So it's the same liability that we carry as well. Now, the confidence level we have is that this has been developed in conjunction with healthcare experts, ER physicians, and at the end of the day, once again, we do not force any single outcome to the patient. For example, in say if we take our daughter's case where urgent care was okay, we still show ERs. And we give an option for the end user to select what they want. On the other hand, this algorithm is quite conservative. So if at all the diagnosis says that it is better off the patient goes to an ER instead of an urgent care, then we do not even show urgent cares because we don't even give that option to the end user. So we try to do as much as we can to make sure that ultimately the user is the one who is making the decision. It's just that we are trying to take all the guesswork out of them,
Yeah.
and also be conservative at the same time. Yeah. But I cannot guarantee liability, just like any other solution that's similar to this.
Sure. This question from Diane kind of like, goes back to the revenue question that we, that you just, that you just explained a while ago. And then I'm going to come back to there's an AI question from you.
Sure.
So the question from Diane is, would an individual be able to subscribe without their employer? Or what about seniors? How can they utilize the service?
Interesting question. We haven't thought through that because for us, we want this to be free to the end user. So we never really thought about charging the customer itself. When I say customer, the actual end user itself. But that's something we will definitely think through. As of now, unfortunately, there's nothing like that exists. We are hoping to go through, or not just hoping, but we are actually going through either health systems or insurance companies, our employers.
A question regarding artificial intelligence here. This system is based on cloud, and I'm assuming that artificial intelligence is a big part of the back end of how it works. Mm-hmm. So what Chris wants to know is, what do you say to skeptics that has problem trusting AI to work appropriately?
So that definitely was a concern. In the last 12 to 18 months, there has been a significant change in the mindset, especially, again, healthcare, we got to understand, is very conservative, and adopting technology is not one of their best routes. But in the last 12 to 18 months, we have seen that this AI-based, specific to triaging as well, AI-based triaging has been picking up a lot. Even health systems are being more open to adopting these technologies. So I think in general, it's getting better. On the other hand, we do have another product that does that uses AI in image processing for pathology. We see a lot more resistance there because they're saying that, no, we are not ready for that yet. But specific to AI in diagnosis and early symptom analysis, I think they are a lot more open to that.
Bhaskar, are you hooked up to other platforms like WebMD or other online services? Does that provide any value to you all?
Absolutely, yes. We actually have a couple of them on the roadmap. One of them we are working on as we speak, as a matter of fact, WebMD, because the outcome of triaging doesn't always mean the patient has to go to a doctor to be seen, because sometimes it may be but they may be better off just staying home and taking care of themselves. So in situations like that, and also when they need care, we are planning to provide links to information like that's available on WebMD or other sources that can provide the patient with more insight into what they're experiencing. So what we try to do, one of the key things here is We saw, especially with triaging, the ranking of the facilities and all, we are the first to do that. But with respect to triaging, the triaging was very complex in most other solutions. But you had to go through 10 different steps before you really could get to a conclusion. So what we did is we tried to simplify that, but at the same time, give more information to the patient if they want to dig further and figure out what's going on. So yes, to answer your question, yeah, we do see that there is value addition, and we are, as a matter of fact, adding hooks to those things.
Okay. Now, once, let's say, an organization decides to adopt your platform, so for the individual user, would they access that through their insurance, or they can download the app directly?
We tried the app thing initially for our own app, but this is not a social networking app or a game or something, so it's not easy to get the adoption. So we, as of now, are trying to go through the apps of our customers. So if you say Blue Cross Blue Shield is your insurance company, then this will be integrated into BCBS's app. Or say Lehigh Valley Health System is your health system, then this will be integrated into their app. So this way, we are not forcing the users to download a different app, but at the same time, if they want to, we will make it available.
What about the question of impartiality, right? Since you are generating revenue from systems that supports you, where does impartiality come into the picture?
Yeah, that's a good question too. So that's why if we are a solution that is being used by a health system will only identify their facilities. So there's no partiality, right? It's specific to them. So if you are going through Lehigh Valley Health Systems interface, but it is using CareBot in the background, you're going to see Lehigh Valley Health System facilities. Now let's take insurance company where we are going to show all of them. There is no partiality there at all because it purely uses all the data that we are getting and it ranks them and prioritizes. Now, just because Lehigh Valley, here, it's not partial, but it is logic. So say, for example, in this area, let's take the two big health systems, Lehigh Valley and St. Luke's. If we are working with Lehigh Valley and not with St. Luke's, Lehigh Valley facilities may be prioritized for few reasons. And again, that is maybe, but in different circumstances, they may not be. For example, if we are getting real-time wait times from Lehigh Valley, and we do not have real-time wait times from St. Luke's, then we obviously prioritize real-time wait times over guesswork. So that's built into the system, not as a partial thing, but it is to do with logic and how we decide on it. On the other hand, if Lehigh Valley's real-time wait time is so bad that St. Luke's predicted wait time is better, St. Luke's is going to be prioritized. So there is absolutely no bias introduced into this one that is dependent on whether a specific health system is our customer or not.
Okay. No, a great presentation, Bhaskar. I think the app and the platform that you guys have developed, I mean, I'm getting a lot of comments here about the innovativeness of it. So a last question, kind of a last question that I have for you before we move on to Deb. And by the way, guys, we can still, if there are other things that you want to ask Bhaskar, just put it on the chat. We can also address that, at the very end. So right now I see that your CareBot is trademarked. But do you also have any sort of IP protection on your platform, or is that not applicable to what you're doing?
Oh, we do. We have patents pending.
Okay.
We have 2 patents pending, and the third one we are filing soon.
Okay, great. The one question that we ask all presenters at the end is, 1 Million Cup presenters, is that how can we help you? Are there some things that we can do to support your initiative?
Absolutely. I think one of the biggest things for us would be if we can get a customer in the Lehigh Valley area, then that would be great. And when I say customer, St. Luke's or Lehigh Valley Health System, one of these two, that would be fantastic. I guess that would be, if any, I don't know how 1 million cups exactly works in terms of this networking and trying to say spread the word. But yeah, the biggest help would be if we can really get a customer around here in the Lehigh Valley area.
Just to answer your question about how 1 million cup works. So one purpose of, a key purpose of 1 million cup is to connect entrepreneurs and startups and existing business owners with resources that are available. That connection, it can also be businesses, right? At the end of the day, you are looking for customers,
right,
to scale your business. So one thing that I would recommend is that at some point in time, visit us and we can sit down and talk about it, and also participate in other 1 million cup. You never know, who can provide you that introduction.
Absolutely.
What you are needing right now is a connection to either Lehigh Valley Health Network or St. Luke's is what you're asking, right?
Thank you very much, everyone.
Well, thank you for a great presentation.
So Valley Fruits and Veggies, this is our 5th year of strawberry production here. We are located on the corner of Weaversville Road and Colony Drive in Bethlehem. So we have this triangular property. If I zoom out just a little bit here on the Google Maps, you can see that, to the north of us is farmland. And then to the south of us, we've got the airport right here. You can see this is the giant FedEx Center that's, off in the distance behind me. So we're right on the edge of Hanover Township, but we're in East Allen Township ourselves. So Bicentennial Park is right across the street from us. We are beyond excited. Is the wind too bad, guys? Are we good?
You're fine.
Okay, so what we are beyond excited is we struck up a deal with the neighboring farm that we have about 10 acres here, 3 acres of strawberries. This here is 25 acres, these two kind of triangles, the mountain peaks one at a time. And we are now subleasing from that farmer who actually is leasing from the airport. So go figure, it needs to be a trifecta. That we are expanding our corn maze here this year. We're planting pumpkins. We're going to be expanding more strawberries. And hey, what better time to expand a business when you don't know what's happening because of a global pandemic. But that's what we're doing, and that's what we're here for with things. So along this way, we have 3 acres. So behind me, as we name them fields 1, 2, and 3, we'll be going into them in a little bit. But just for those other entrepreneurs out there, we also own the Gyro Company at Coca-Cola Park. What another great business to have right now in the middle of a global pandemic when there is no Major League Baseball. Behind me is a slew of equipment that just came off the winter time. We have a snowplow company for the large warehouses in our area. And in addition, within all of this, what's happened since 3 years ago is I have a digital marketing agency. So I want to talk today how it all collides here on this property and what's going on. So right now, as I walk into the field, and let's see, Raja, I am more than happy for you to toss questions at me at any time if, people have them, so we can make this a conversation, because there's lots of little bits and pieces of what's going on out here. But as we go into the field, strawberries are on a 3-year rotation. If you've ever been in a backyard and a strawberry plant is like really, really tiny berries, it's because a strawberry plant only ever produces the same poundage of berries, no matter how big the plant gets. So after so many years, your berries get smaller and smaller, even though the plant's bigger and bigger. Well, it's not fun to go strawberry picking if you're having to pick 10,000 little berries of such. So as we get down here, and I'm going to sit on the ground here for the live demonstration and showing you the plant, we've got all these blossoms coming out, and each and every blossom is going to be turning into a berry. Now, this blossom here, and I'll show you with it, it was damaged from a frost. So these
You're cutting off again, Deb.
Not now, okay?
Yeah, it's better.
We'll keep talking. You let me know. All right, very good. All the white things are actually a folded up blanket that we cover the strawberries with, that pad about, I would say 3 to 7 degrees, depending upon what it was the day before. Also in the field, because it's getting so cold, we're also setting up irrigation for Friday, Saturday, and Sunday nights. You can actually insulate plants with water, and with the ice on top, you can take your plants down to 20 degrees and they'll survive. So it's we're actually testing out the irrigation right now. So thankfully, today's only Wednesday. We have till Friday to really get this set up so that we don't lose our crop, which is very, very important. We plant on plastic, as you see. What that does is there's a drip line irrigation underneath, and that allows it also weed control and what we're able to do. We do get the question all the time, are we organic? It is hard to be organic in strawberries, because just like you buy the strawberries and they mold like, you know, instantly when you get home, they can do the same thing in the field. So able to use fully organic practices, unfortunately, is where we're either going to lose our on top of things. The Pennsylvania Department of Agriculture is. Every year they come out and do soil and leaf samples and everything else. And we're very, very proud that we have had 0% residue on our plants and our leaves every single year. So we really, really stress the best practices and everything that we have going on. So I'm sorry, guys, I was sharing stuff and showing stuff along the way. So let me do this. All right, so as we are out here, we will be open, and once a blossom happens on a strawberry plant, you have 21 days until you get a berry. So we know Memorial Day weekend is probably when we're going to be opening up. Our fantastic strawberry shed is where we have our strawberry shortcakes, our strawberry milkshakes, everything going on. In past years in this grassy area, we're able to have a big tent and all this kind of thing. Well, we're kind of going to have a strawberry social distancing fest because thankfully in having all of this open space, if you took 1 acre of land and pivoted people on a 6-point pivot, you can have over 1,000 people in an acre. So thankfully, you know, we haven't been that busy and we don't expect to be that busy, but it's a wonderful place that you can come out safely. We're going to make sure, just like the local farmers markets have been doing, to make sure that there's plenty of space for people to spread out. But we've actually been tracking farms that are in the Carolinas right now because they're fully open and they have been inundated with people and selling out every day because people are just going nuts, wanting to get out of the house, wanting something safe to do. You know, other things we're just trying to do right now is educate people up and down about, you know, you're just going to have to be polite and respectful and patient and understanding everything that's going on. But we're glad within agriculture, and whether you love or hate our governor right now, thankfully the Pennsylvania Department of Agriculture has been very on top of things and very supportive of, you know, farmers and growers and everything else going on. Any questions so far about the actual, you know, production of the berries or anything?
Not yet.
Okay, awesome. So as I sit down in my office of my golf cart, because it's also very therapeutic up here, and we do have a volunteer program. It's called Weeding Cardio. So you can get 16,000 steps in easy within 3 hours if you'd like to help us come weed our fields. But the background of what I do want to show you today, as anybody here in business for themselves, and let me share my screen again, is how we have built what we've done has been purely utilizing Facebook. And I'll show you here. So please connect with me on LinkedIn. There's that one. All right, the right screen. So when we started 5 years ago, we were at 0 audience and we had to build it up from scratch. And now we're heading in towards almost 4,000 followers, which is very exciting. And I'm not crying, it's just windy out here. So there it is. So yeah, 3,600 followers. But the key to this has been being able to communicate effectively with our audience. We're always up here doing Facebook Live videos. The last one we did, because we get to this time here and people get excited. And as you can see, we have 169 people like it, 43 comments, 11 shares. And this is where Facebook turns into dollars. And this is where me and my marketing communications really comes into play. So what we discovered a few years back specifically with Facebook and events, that if you are able to figure out an event for your business and put it there properly in front of the audience, amazing things happened. So events are shared on the back end of your Facebook business page for 1 year. So I can go back and I can see what happened. So here's our event last year, Lehigh Valley Strawberry Fest. 69,600 people saw this event in their feed. 5,300 people actually clicked interested or going. And this is why in one weekend, we sold out of all of our berries and had over 3,000 people here on site. And the value of doing this over and over again is you begin to get to see your audience. So Facebook begins to show you insights of what's going on. Because a lot of time as business owners, we think we know who we're advertising to or going after. And those first couple years, we were advertising to everyone. But then something happened here and we found out that our audience over and over again, if Facebook loads this properly here for us, look at the percentage of women who are reacting to what we're doing into men. And so at this point in time, you know, we are not even spending any dollars on men when we do advertise because we realize it's the women that are making the decisions, 84% there compared to 16%. So sorry to ignore you guys, but you know, I haven't, as I've mentioned this to other people, I haven't had a man disagree yet about that kind of assumption of things. So, and what's pretty exciting is the first couple of years we did spend advertising dollars on Facebook to boost things. This was completely organic last year. We did not spend a dime to get this response. But it certainly has to do with, do you have the right event at the right time for the right you know, audience out there? And if you can think of anything right now to get people out in a safe way, people are going to go nuts about it. All right.
That's great feedback. So Deb, so you are not, what did I hear it correctly that you are not spending any dollars on Facebook ad right now? So you're just
not spending any dollars on Facebook ads. What we're trying to figure out right now and what we really want to be doing this year, and just the difference of what's going on, probably starting next Tuesday, we will start a local ad in general, you know, 15-mile radius around the farm, just really trying to push forth the COVID-19 safety protocols that we're bringing into play here. We know that, you know, while we're extremely comfortable in what we're doing out here, that we need to spend that extra time reinforcing others right now so that everybody can feel comfortable. And so what we've also done is we've spent time on our website making sure that as people see Countdown, join the VIP list, it's this COVID safety update, making sure that we have the resources and we're citing it back to the state and where people can go to so that there's no question about what to expect when you come on property. And yeah, and just that we're doing everything possible to keep everybody safe and healthy and providing awesome berries.
Yeah. There's a question from Ann here,
yes.
Going back to when you were, you know, when you were walking around in your farm there. So she wants to know, can you explain, so what do you mean by when you say organic growing?
Sure. So what's interesting about there is organic and biologicals. So a biological is an approved pesticide, herbicide, or an insecticide. I can get the list. I can get the website to you later if somebody would be interested. There's actually over 3,000 approved biological herbicides, pesticides, insecticides that can be used. As a farm, you know, to be called organic, you have to prove for 3 years that you have only used those approved chemicals on your property. They're still chemicals. H2O is a chemical. You know, it's that science backing of what's going on. What we emphasize here is best practices, which is actually even more valuable than organic, but it doesn't have a nice, neat, you know, marketed label to it. One example, great, is copper. Copper is 100% organic. Copper will 100% kill you if it gets in your water supply at the wrong amount. So you still have to be careful in what you choose at what time for what application.
Yeah. Going back to your, going back to the advertising, especially the social media advertising question, do you also do Instagram?
We are on Instagram. What we have found within our niche market of what we do, people are looking for an actual activity. Instagram has not been forth and grown in the way that Facebook has, because it is not event based. It's more of a reporter base of what's going on and a product base in advertising. And at least that has been our experience and what we have done thus far. But we're very much on Instagram. My two employees, AKA my teenagers, are responsible for the Instagram account as part of their duties. And it's fantastic that we've been able to fully integrate agriculture into their education at this moment of time, as we've needed them up here a little bit more this year.
Okay, but Facebook is still the primary driver for you.
Facebook is the primary driver, as it seemingly is the, the key audience that begins coming to us is that, woman, small children, they're looking for something to do. And then that graduates into other things from there to the, 40, 50, 60, where we're more looking for, canning, jam, margaritas, whatever it may be at that moment. So it's interesting to see how different age levels are looking for different activities as they come to the farm. But this year, we're hoping people are planning ahead and understanding food supply. Just what's unfortunately happening within the beef market, hopefully doesn't happen with the strawberry market. But when you have strawberries and you're looking at a company like Driscoll's that owns 80 to 90% of the strawberry market within North America, and all of a sudden their supply chain goes down, there's not going to be any berries. And berries freeze wonderfully. So I can only encourage you more and more to come on out.
Yeah. I was actually going to ask that question, Girish. So, Deb, you own a couple of businesses, and two, one is farm, one has to do with the baseball, right?
Yes.
And then you also have a, social media marketing company. So how was the COVID-19 situation impacted, your businesses? What are some things that you guys are doing to adjust to the new reality?
Yeah, it certainly is a new reality for the moment. It's feast or famine, right? As small business owners and what we're trying to do. And, the three things, whether I talked to a client of mine yesterday who owns, batting cages. And he's like, I don't understand why golfing driving ranges are open, but my outdoor batting cages cannot be. So I think as business owners right now, we're struggling with the inconsistencies. We all want to help. We all want to make sure that everybody's as healthy as possible. But we're trying to figure out, well, why is this here, but this is here, and it doesn't make much sense. So personally in our businesses, we've gone after everything, whether it's PPP, the EIDL, unemployment, whatever it is, we've applied for it all, saying, hey, we'd rather apply, get rejected through the process, or understand later on that we're not, okay, this doesn't work for you, than to hear after the fact, oh, you could have taken advantage of this. So that's definitely what we've done. I had an interesting conversation yesterday with our Brethren Mutual policy having to do with the gyro company at Coca-Cola Park. And I encourage all business owners to take a look at your business interruption policy, because right now, all insurance companies are denying any claim of business interruption, saying, oh, it's COVID, it's COVID. But here's the thing, and I'm currently working with a law firm in Chicago that's putting together stuff that, again, I'll get the information out. It is not COVID that has shut our businesses. It's been the government regulations that have shut our businesses. I am not sick from COVID and a virus and unable to operate my business. I'm fully able to operate my business. I'm shut down by Major League Baseball, who's telling Minor League Baseball, hey, you can't operate. I can't even get into the stadium if I wanted to start doing takeout. So I totally stumped the Brethren Mutual lady yesterday. She's like, oh, it's going to be denied. I'm like, well, here's some things. But what I'm being encouraged by different legal advice right now is go call your insurance company, get denied, have that paperwork, and just hold on to it for the moment. Because I guess also, which I don't agree with the end result, but that's beside the point, there's a class action that's coming up in Pennsylvania that people are trying to put the responsibility on the state to pay out the business interruption insurance because they're the ones that shut us down. So the insurance companies are deflecting it. So that's one business back end that we're doing. Strawberries, we're expecting to have a phenomenal season. Gyro, obviously, until baseball gets going, and then even then, who knows?
You're cutting off again, but go ahead.
Oh, all right, let me know here.
Yeah, it's coming up now. Go ahead.
My marketing clients to know that this is the time to double down and not back down because it's going to
Cutting
be
off, cutting off again, Deb. You are,
It's
you're.
going to have time to double down. No, it's so bizarre.
Yeah.
I'm connected to my phone. That's right here. So how are we doing now? Is that any better?
Yeah, better.
Is that any better? Okay. Thank you again all for your patience with that. But, we have a couple $100,000 worth of equipment right here. And thankfully, John Deere, Caterpillar, all of them, you call them up and it's amazing what they're doing for people right now and helping, adjust payments and delay things in the back end of a lease or a purchase or anything like that. So, the strategies that we've done is communicate with our vendors, with our, responsibilities that we have out there, with our customer base. And the more communication that you can do and the stronger that you can be is definitely where you're going to end up in a great place.
Yeah. A question here from Marino regarding, automating farming, right? So as you are expanding your farm, how do you see that play out? So, and technology is certainly getting cheaper. I'm pretty sure it's the same thing. I'm assuming that farming is not an exception to that rule. So are you guys thinking about automating parts of your growing and picking process?
Yeah, so we are already automating as much as humanly possible because farm labor is an issue. As soon as the strawberries come out, we then begin putting out ads for pickers and things like that. We've learned not to do it ahead of time because you can't depend, unfortunately, for people who are willing to get paid per box of strawberries of what's going on. But when it comes to automation, and I'll take you into our shop here, so excuse the lighting change, technology often has to come with efficiency. So this is, one of our pickers behind us. It is actually, it's called a crop care. It's got solar panel on it. You actually lay on it. And so we use this to pick strawberries. And while the human is still in there, but it also works to plant the strawberries, the automation that comes from it is absolutely fantastic. We've got the collection of implements that pretty much, myself and my husband and my 2 children, we're the ones doing all the core labor when it comes to, planting and monitoring and everything else that's going on with it. If anybody's ever heard of Weather Underground, so we have our own little weather station here, and it's not anything beyond the BJ's purchase of the Weather Underground. I think it was like $75, but what Weather Underground has done is genius. You go on weatherunderground.com and they have they sell these $75 units, and then you can click on units, thousands and thousands of them, that then they aggregate the data to make better decisions about the weather and what's going on. And then we're able to hop on the app and see, what time did this temperature happen? How is that different from a weather station that's just, a mile away? And that saves a crop over and over again. But the automated picker, that's the cream of the crop. We're watching and waiting for it. Strawberries are so darn delicate. They're also very color centric. Unlike a tomato that you can pick when it's just a little bit red and it keeps ripening, a strawberry will never get more ripe once you've picked it. So there's a lot of different things that make it very, very complicated. But yeah, we're all about automation as much as possible here.
Yeah. Any, if there's any further, question for Deb, just put that in the chat and I'll ask her. But I think we're coming towards we have come to the end of the question for you, Deb. So here's one question for you. So you've already presented the 1 billion cup before. So how can we as a community help you, especially with this business that you presented today?
Absolutely. Come buy strawberries and have a milkshake. We can't wait to see you guys. Please find us on Facebook, spread the word, share awesomeness, write us a review. That's another thing right now. Write a review for every business you interact with because it's something that helps so much. So, hey, let me fill you with strawberries and would be happy to do so. Okay,
great. So that kind of brings us towards the end of our presentation today. So before we depart here, any announcement? Anyone like to make an announcement? Go ahead, Rita.
Hey everyone, the weekly coffee talk is tomorrow. We're going to be talking about how coronavirus has impacted your business in a positive way. We're looking for the positive ways, things you've learned about your business, and how to keep the pipeline full, even though you might not be able to operate the way you have in the past. I'm going to put the details in the chat, and there's a link to register and get more information. Thanks, everyone.
Thank you, Rita. Anybody else? Just unmute
Yes,
your mic.
Raja, it's Santiago.
Where's Santiago?
Santiago at Sobe Coworks. With the idea of getting out and being more active on the weekends, we have a community garden going here at Sobe Coworks. We try to keep it limited to a few number of people, but we do practice social distancing. I ask everybody to come with their mask. And what we've been doing is growing a community of people that would like to participate in helping grow or learn about growing their own food. We have an objective of growing at least 500 pounds of food out of the garden here at Sobe Coworks. And in addition, this evening at 6:30, we have a network marketing sales training. It's a agnostic type of multi-level marketing related to people that are actually looking at that as a direction for them to take their careers for supplemental income. We basically focus on the marketing and sales training, and we basically practice, we believe that time-tested sales methods and procedures are the best way to go. There's some basic rules, but we don't always have them, so you get exposed to that if you're interested in that. Thank you. And that's at 6:30. You could reach me if you need to reach me directly at santiago@sobecoworks.com.
Thank you, Santiago.
Raja,
Anybody else?
tonight I have a presentation on making your comeback bigger than your setback. It'll be 6 o'clock. I put the information in the chat. Also, I'm doing a project where I'm interviewing local small business owners, and I'm publishing it in a newsletter to my entire database. So if anybody wants the free marketing advertising for a 15-minute interview, my email address is in the chat as well. So thank you.
Thank you, Sam.
I have an announcement too.
Yep.
This is John Wilcox. I'm with Berkshire Halfway. And I have a monthly leadership group. It's complimentary. It's not about real estate. It is about, we have a different topic every month. And our next meeting is next Monday, the 11th at 6:12 p.m. And the topic is self-help for leaders. Of course, we'll be online for this. This is our second online meeting. And you can find information on my website, which is topdoghometeam.com. Again, topdoghometeam.com. Click on leadership and you can register for the event. Again, it's complimentary.
John, one thing that might be helpful is that if you want to go ahead and text that, put that website on the text so that in this recording will go to all the participants and they can also see the text. So.
Okay.
Anyone else? Well, if there's no other announcement, well, thank you all for participating today. And we look forward to seeing you next Wednesday for our next 1 Million Cup presentation. Deb, thank you. Bhaskar, thank you for taking your time and accommodating, in this new platform. Bhaskar, feel free to, reach out to us and also shoot me an email and see if I can put you in touch with some folks here in the Valley, especially.
Raja, I just one point.
Yes, Sam.
So people over the last couple of weeks have been asking me how they get to present, and my explanation was you go online and you register, and then you get an email. So that's still the same, right?
Yeah. So it's pretty easy. You go to 1millioncups.com. That's the website, and then you have to select the community. Our community is Lehigh Valley, right? And once you select that, I can send that information out again. And it just, once they basically click on apply to present, it comes to us. It's a pretty.
Thank you. Yeah, some people said, "Oh, how do you do that?" I said what you said, but
I will send that information to you, Sam, and you can forward that. All right. As I said, thank you all for participating today, and look forward to seeing you all next Wednesday. If there's anything else that we can do to help each other, let's stay in touch. I'll make sure that the video of today's session goes out along with the chat. You have been receiving that on a weekly basis anyway. If not, we always put that in our constant contact ad that goes out on Friday, publicizing next week's presentation. We have listed all the past presentation through Zoom, so you can not only see this one, but also any previous presentations. All right, so have a great weekend. Deb, enjoy the forum, and look forward to seeing you all next Wednesday. Thank you.
Thank you.
Thank you.
Thanks, everybody.